Ehave is a provider of digital therapeutics, and the therapeutics deal with evidence-based therapeutic interventions, and they're used primarily for treatments for brain diseases and also disorders with psychedelics and other medicines. So with me is the CEO of Ehave, Ben Kaplan, to talk about really this is an emerging industry. I've been seeing more studies on this lately. And Ben, can you give us an update? I know there was ketamine was something that you were working on, the launch of that. Can you give us the update and the revenue model for ketamine?
Yeah, sure. Hey, Jane, good morning. It's good to see you again. I'm live here in Kingston, Jamaica. I was just down here for a psychedelic conference, and it's very exciting what we're all getting into. Ketamine is a concierge service for home delivery of ketamine with licensed professionals using our protocols. And we look to launch hopefully in Q4 here in Miami. We are in the process now of finalizing the technology end of it, the legalities, and the transportation, which will be a mobile ketamine clinic. So it's really exciting. We see hopefully early 2022 revenue streams coming in from that subsidiary.
So you're launching in Miami. Will there be a nationwide rollout? I mean, what does it take to get something like that through all the permits and all the approval processes?
That's a good question. You know, because in the U.S. we have 50 states, each one has their unique regulations on medical clinics, doctors, and patients. And so we chose Florida, A, because I'm located here in Miami, and B, it's a large populous state. So we looking to go up and down the coastline. So we started in Miami, we'll go up to Palm Beach, then over to Tampa, up to Orlando and Jacksonville. And once we have locked down Florida, we'll look at other states that have the same kind of regulations as Florida, and then try to partner with clinics in those states to license our technology, IP, and our operations. And to go out nationwide will probably be a few years. Once we prove the model out in Florida, we'll be able to duplicate it in Texas and some other friendly states. But today, Florida is our ground zero, and we see multiple ketamine clinics that are opening up throughout the state. So that's a great partnership for us to have many people that can use our product.
How is the Healthwiz application integration going with the dashboard?
Healthwiz is going pretty good. We're on schedule. Hopefully in the next few weeks, we'll be launching on the iPhone, Apple Store, and Android. The co-branded Ehave Healthwiz application front end. And that should also create us a revenue stream, collecting the health records and providing IP and gadgets for the consumer to use. And then those data sets that we collect will be used in research and development of other products.
Okay. Now, is this application, once it's integrated, is this for the medical market, retail market? Is it for research, all of the above? How does it work?
Well, most of the technology that Ehave is compiling out and building and launching is multi-revenue streams. The first is the consumer interface to B2C. That's where all the data starts. So our most important application is the communication between us and the consumer. Once the consumer and us are partners in their health records, we can then take that data and go to institutions, researchers, drug companies like Compass, MindMed, companies that need these data sets to offset some of the research that they're doing versus what we have, so they can compile their drugs that they're trying to get approved with the FDA. And so we have a vertical, but it starts with the consumer, and then it ends up with the researchers and the companies that need the data.
Okay. Now, the last time we talked, there was a clinical trial that you were, I believe, just starting. What's the update on that?
Yeah, we're doing a ketamine trial study here in Miami with TriStar Wellness. They were just bought out by Ketamine One. It's a large Canadian company on the TSX. And we're going to give out sessions to 35 individuals that will get their ketamine sessions and their brain mapped, so we can see if there's any indications of what's going on before, during, and after a ketamine session. We just hired an IRB. They're giving us the regulations and rules. We have the team. We have the technology already in Miami. So we hope to do the trial sometime in August, early September. And it should take around 60 days of administering the ketamine to the 35 patients. And we'll be choosing those patients using the Healthwiz Ehave partnership application. So as we go out and market this trial, they'll be coming into using our platform to deliver the data that's needed for the doctors to decide which patients are going to be included and which will be excluded from the trial.
Thank you so much for joining us again.
Yeah, thank you, Jane, for having me today. Have a good day.